I, Dr. Mohammad Akram, Department of Eastern Medicine, Government College, University, फैसलाबाद। आज मैं डायबिटीज़ के बारे में बताऊंगा। डायबिटीज़ जो है वो एक ऐसा डिसऑर्डर्स है जिसमें यूरिन के अंदर यूरिन जो है एक्सेसिव मिकदार में आता है और उसके अंदर ग्लूकोज मौजूद होता है। डायबिटीज़ दो तरह की हो सकती हैं, डायबिटीज़ इंसिपिडस और डायबिटीज़ मेलाइटस। डायबिटीज़ इंसिपिडस जो है वो इस वजह से हो सकता है कि उसमें एडीएच की डेफिशिएंसी अब्सोलूट या रिलेटिव हो सकती है, जिसमें क्या होता है कि ट्यूबुलर रीअब्जॉर्प्शन वाटर की नहीं होती किडनी से, और एज ए रिजल्ट जो है वो यूरिन एक्सेसिव मिकदार में आता है और एक्सेसिव जो है वो थर्स्ट होती है। Diabetes insipidus results in primary loss of water from the extracellular fluid, causing hyperosmotic dehydration. Diabetes insipidus has nothing to do with glucose metabolism. Primary or central diabetes insipidus, it is the absolute deficiency of ADH due to a defect in the posterior pituitary gland. The posterior pituitary gland is unable to secrete ADH at all. Secondary or nephrogenic diabetes insipidus. It is the relative deficiency of ADH owing to a defect in the ADH receptor present in the kidney. The ADH level is normal or above normal. Diabetes mellitus. It is a metabolic disorder of glucose due to absolute or relative deficiency of insulin, characterized by hyperglycemia, which may or may not be associated with glycosuria. Diabetes mellitus means sweet. Therefore, diabetes mellitus means urine having sugar in it. It is of two types: insulin dependent and non insulin dependent diabetes mellitus. Insulin dependent diabetes mellitus. It is also called juvenile onset or type 1 diabetes mellitus. There is absolute deficiency of insulin due to viral or autoimmune destruction of beta cells of the islets of Langerhans of pancreas. Thus, glucose cannot enter into the cells and cannot get metabolized to provide energy. The destruction of beta cells is gradual. It takes many years after the autoimmune attack, but the symptoms appear abruptly when 80 to 90% of the beta cells have been destroyed. It occurs usually during childhood or puberty. Patients are usually undernourished. Among all the diagnostic, diagnosed diabetics, 10 to 20% are found to have insulin dependent diabetes mellitus. Genetic predisposition is moderate, inheritance is not common. Metabolic alteration due to hyperglycemia results in serious complications. Ketoacidosis, a life threatening acute complication, is common. Plasma insulin levels are initially low but later on become absent. Patients are unresponsive to oral hypoglycemic agents and therefore always need exogenous insulin. Non insulin dependent diabetes mellitus. It is also called adult onset or type 2 diabetes mellitus. There is relative deficiency of insulin as well as unresponsiveness of the insulin receptor on the surface of the target cells. Thus, glucose cannot enter into the cells and cannot get metabolized to provide energy. Non insulin dependent diabetes mellitus develops gradually without obvious symptoms. It is often an incidental finding. Non insulin dependent diabetes mellitus does not involve viruses or autoimmune destruction of beta cells of the islets of Langerhans of pancreas. It occurs usually after age 35. Patients are usually obese. Among all the diagnosed diabetics, 80 to 90% are found to have non insulin dependent diabetes mellitus. Genetic predisposition is very strong. Inheritance is most likely. Metabolic alteration are milder than that observed in non-insulin dependent diabetes mellitus or insulin dependent diabetes mellitus. Metabolic alteration are milder than that observed in insulin dependent diabetes mellitus. Hyperosmolar hyperglycemic state or coma is an acute complication and is common. Plasma insulin levels are normal or even high. Thank you very much.